Sarah.
Hi.
Thanks for joining me today. Today we're going to have a chat about Nurse Next Door, your Perth North franchise, and a little bit about your journey as a provider, and then about your engagement with Tanya Gomez Consulting. You've been operating for about 14 months. You specialise in working in aged care and NDIS clients specifically here in Perth with your in-home nursing and caregiving supports. Can you tell me a little bit about what you do at Nurse Next Door and what led you to become an NDIS provider?
Well, what do we do at Nurse Next Door? Obviously, as you've said, we provide in-home supports to people who are on home care packages, NDIS or private pay. We provide the range of services from 24/7 nursing care to caregiving companionship. Our care is very specific to what the individual requires. So basically we can provide any services that the client requires, obviously provided that we have the staff that are trained to provide those services. What led me to be an NDIS provider, which I guess led me to Nurse Next Door. I've been a registered nurse for about 23 years and I've worked in a variety of different specialties: disability, paediatrics, mental health. I was really looking for something that I could do now at this point in my career, given that I could no longer do my clinical nursing. I suffered an injury at work, which has meant that, I couldn't be out at the front line, doing hands-on clinical work. While searching for something or some way to use my skills, I came across the Nurse Next Door brand. And after some investigation, sort of jumped in.
Amazing. What would you say you're most proud of accomplishing over the last 14 or 15 months as a provider?
And it's always hard to kind of look at the good things that you do, but I think we were the first Nurse Next Door location to launch in Perth. The Nurse Next Door brand here in WA was non-existent. My mission or my passion was just to help anybody. And so we didn't say no to any referral that came to us, which meant that currently, we have clients down in the wheat belt. We serviced clients that other providers said no to. We put together teams in places that participants hadn't been able to get consistent care. So I feel really proud of that we had the capacity just to say yes, which meant at times, stressfully trying to recruit and get teams together. I'm proud of the quality of work that we do, that my team does. We do offer, quite a unique model of care, and that is very different to what other providers are doing. I'm proud of the fact that we can turn up every day and, deliver the best possible care to our clients.
Beautiful. What is the most rewarding part of being a provider?
Linking in with that whole theory that we get to provide good quality care to people every day, and we get to keep people in their homes, because essentially the people that we come across, they want to stay in their own homes. They want to have their care delivered in their home. Until recently, a lot of people didn't have a choice. That gives me a lot of joy, knowing that we can keep people in their homes for as long as possible or as long as they want, and we can provide that, good quality care for them.
Beautiful. You've mentioned a few things that you do differently than NDIS providers, but what is it that sets you apart from other providers?
I think the fact that we are nurse-led and nurse-owned means that we provide that really holistic overview. We pick up on things that might otherwise be missed. Our caregivers are amazing. They deliver exceptional care, but they're limited in terms of what their background is, what their knowledge, what their skills. Our registered nurses can work directly with our support workers and then oversee that client care. Our model encourages our caregivers to contact the nurse and check in. When you're dealing with vulnerable people, and particularly people that have complex medical histories or psychosocial difficulties, there is the potential that things get missed. When clients come to us, I look back at things, I think, why didn't someone pick up on this sooner? Or, how did this get to this stage? Our model of care really captures that, holistic view of the client's care.
What do you think is the most challenging part of being an NDIS provider?
dealing with people, the human kind of aspect can sometimes be challenging. Sometimes I'm challenged by the fact that I can't give them the care that they need. I can't provide them with the care hours they may require because their funding is limited, or, they've been with another service provider and all their funds have been used. That is one challenging aspect, dealing with people in vulnerable situations and wanting to help them. The other challenging part is finding good caregivers, good nurses, people who share the same values as you, who have the same passion. I really try hard to make sure that we get that right fit for our client. As soon as we notice that it's not right, we're doing something about it. That comes with challenges. Working in the community is a really different place to work. It's not a hospital, it's not a residential aged care facility. Our staff are going into clients' homes. Sometimes they don't know what they're walking into. We want to make sure that we are complying with, standards and regulations and legislation. We have to make sure our staff are also aware of what their, roles and responsibilities.
You engaged Tanya Gomez Consulting to help you with your audit prep and a general consultation around the audit process in preparation to become a registered provider. What made you decide that you needed help with that process?
Nurse Next Door have all of the tools, materials, systems and structures in place. A lot of it, though, is about localizing that to your business, NDIS, and it has a bit of a language of its own. I'm really acutely aware of, the responsibilities I have as an NDIS provider. And even in this period of time where I've been operating as, an unregistered NDIS provider, I have tried to practice as if I am a registered provider, because I do think that, it's important to understand what my responsibilities are, and to ensure that we're providing the safest care for our clients. We've got, the right tools for our staff, and that we're providing them with a safe workplace as well. So I did find, though, that trying to put it all together and localize, so find those resources that Nurse Next Door have, localize them and, pull it together for my business was where I was kind of getting stuck. Yeah. That was when I thought, well, I have connections and I really need to kind of get that stuff sorted.
And so you've started the audit coaching process, you're getting ready for your first audit. What has been the process so far? How have you found the experience of the audit coaching, and how is it helping you in preparing for audit?
I think the thing I love most about the group coaching program is that it's really accessible. I can do it at any time. I can work through it at my own pace. I can go back and recheck things. All the tools and resources are already there, especially, working a business where I'm at times hands-on and then, administrative. I find that trying to find time to kind of go through those things really challenging. So the fact that I can just pull that up, it's online, I can access it, watch it as many times as I want. I don't have to worry that I've missed something or, I haven't understood something. So I think having that resource there is really valuable. And I can also work through it in a really structured way. Mm-hmm. There are lots of pieces to that kind of puzzle that I'm finding. If you don't kind of work through it in a systematic way, then you can still miss things.
Are there any unexpected benefits in the audit coaching program that you didn't expect? Are there things that you had learned that you didn't expect to, or there are resources or tools that you've gained that you can use in your business that you didn't expect to be there?
I've done some quality and risk work in other positions that I've held before. And so I sort of had this reasonably broad understanding, and I had a reasonably broad overview of what the resources Nurse Next Door had available for me. But as I was going through the group coaching program, I guess I realised that there was still pieces to that puzzle that I'd missed or that I hadn't implemented in a consistent way in my business. A lot of the time, particularly when you're first starting out, you know all these things you should be doing, and sometimes you're doing them, but you're not evidencing them. One of the big things that I needed to kind of work on and, pull together was evidencing what I was doing. So here we were doing all this good work and doing all these good things and, but not enough evidence to show what we were doing.
Yeah, you're not documenting the things so that you can actually say to the auditor, this is how I do it. Here's 5 pieces of evidence to support that. I think that's a big problem for everybody. I think everyone does amazing work but don't know how to capture it, or don't have time to capture it, or don't capture it in a way that is presentable to an auditor. Do you feel like the audit coaching program has prepared you for audit, and you feel like you feel more confident in the process as a result?
Yeah, definitely. Knowing that I have not just the online group coaching program available to me, but that I have the option to utilize your skills and resources too, reassures me. I think if I didn't have access to that, I would probably be freaking out right now, because I know that, with a bit of fine tuning and a bit of hard work, I'll be able to pull it all together. Had I not had that, I certainly would have a lot more stress, and I think I would be floundering, wondering how I was going to pull it all together. I want to go into the audit feeling that I'm prepared, and that, sure, there might be things that I need to kind of improve on, or, processes that I might need to kind of fine tune. But you don't want to go in there thinking, am I actually going to fail? I don't think anyone wants to be in that position.
Absolutely. We're not yet at your audit phase, but hopefully it kind of creates a bit of a safety net for you. So you feel like, look, I've got some idea of what's going to happen. I've got the resources. I can go and work through things at my own pace. And if all of that falls apart, I can just pick up the phone and Tanya will help me get through it.
That is what it is. The group coaching program really is that platform for your one-stop shop. You can go in and, it is, find all the tools that you need. And sometimes I am going through it and I'm going, okay, what does that mean? I really need to contact Tanya and sort of work through that.
Yeah.
But I know that I've got that opportunity and I've got that resource as part of the package.
Yeah, perfect. Well, thank you so much for sharing your experience with me today, Sarah. I wish you all the best in your audit, and I have no doubt that you will be, do amazingly. And I look forward to seeing all the amazing things that's in store for Nurse Next Door.
Thank you. Thanks for having me.
Thank you.